Hi, this is a quick demo of ChatDDx, an app that I built for medical students to practice their clinical reasoning. The idea is it uses AI to generate a patient vignette, and then you can order any labs, imaging, or tests that you think are relevant. You'll get real-time results, and once you're ready, you can submit a diagnosis. The app will tell you if you're right, and it'll give you feedback on your workup. This is meant to fill a current gap in medical school training. In the preclinical years, we learn a lot about diseases in isolation, but we don't get a lot of practice actually figuring out what to order or how to make the diagnosis. That part doesn't really happen until clerkships, and by then you're already being evaluated. ChatDDX gives you a low pressure way to build that skill early. It's also different from existing tools like UWorld. Those tools are great, but they're more close-ended, and in real life, patients don't come with multiple choice answers. So ChatDDX is more freeform, just like in real life, and because it's AI powered, there are infinite patient scenarios to practice with. So just as an example, this is the app. I'm going to go ahead and put in the password here. So you start by choosing how many undiagnosed conditions the patient is going to present with. I think two is a good number, so we'll start with that. And then next, you can choose which conditions you want to be tested on. So for example, if you're already familiar with the workup for atrial flutter, bacterial endocarditis, then you can remove those ones and then they won't show up as the undiagnosed conditions. Alternatively, if you know that you're preparing for a specific clerkship like OB/GYN, then you can choose specifically the conditions that are related to that clerkship. And then you can also even add your own custom conditions here. If you know, for example, that you're going to be working at a clinic that specializes in eclampsia, then you can add your own conditions there as well. But just for this demo, I'm going to go ahead and activate all of the conditions, and I'm going to click Generate Case. All right, so it's generated a patient vignette. I'll go ahead and read it real quick. So chief concern, I've been feeling weak and have been losing weight without trying. A 24-year-old woman presents to the clinic with complaints of fatigue, unintentional weight loss, and recurrent episodes of diarrhea over the past 4 months. She reports losing approximately 15 pounds during this period, despite maintaining her usual diet. She describes her stools as bulky and foul-smelling, occurring 3 to 4 times daily. The fatigue has been persistent, making it difficult for her to keep up with her daily activities. She also mentions episodes of abdominal bloating and discomfort. In addition to her GI symptoms, she's been experiencing increased thirst and urination for the past few weeks, which she initially attributed to stress. She denies fever, vomiting, or blood in her stools. There's no history of recent travel or use of antibiotics. She's concerned about her persistent symptoms as they are impacting her quality of life. I'll skim over the rest of the medical history. And then vitals and the physical exam. All right, so I'm just going to work through this case as an example. Right off the bat, she's talking about polydipsia, polyuria. First thing I'm thinking about is diabetes. But I'll go ahead and start by ordering some baseline tests. So here is in the chat box, you can order any test that you want. So for example, I'm going to start with, let's do a complete metabolic panel, a complete blood count. Um, Let's do a urinalysis for the polyuria. And then I'd also want to check the blood glucose in particular um, for concern for diabetes, maybe even the A1C right off the bat. Um, and let's go ahead and send that in. All right. So now it'll tell me the results of these tests. It'll bold the abnormal values. So it looks like she is a little bit acidic. Um, I mean, yeah, I don't have to read it out loud. You can see the results of the CMP, the CBC, the urinalysis has glucose, her blood glucose is high, and her A1C is high. So that essentially confirms a diagnosis of diabetes. Now I want to check her hormone levels. So maybe I'll order like a C-peptide. insulin, and then maybe do like an autoimmune panel for type 1 diabetes. Um, I can just order like an anti-GAT65. Um, Maybe check her thyroid as well. Um, oops. Um, And it mentioned that she's been having GI symptoms as well, bulky and foul smelling, abdominal bloating and discomfort. So I'm maybe concerned as well for other autoimmune GI diseases. So I'm going to go ahead and um, test her for tissue transglutaminase antibody. Um, and let's send that in. All right. So C-peptide and insulin are low, which is going to be diagnostic of type 1 diabetes. We also have positive anti-GAD antibodies. Thyroid looks normal, but then her tissue transglutaminase is positive as well, which makes me think celiac. In order to confirm celiac, I'm going to go ahead and order a um, upper endoscopy. And we've confirmed with a duodenal biopsy that there's villus atrophy, which is diagnostic of celiac. So once you think that you know what the conditions are, you can click this button to submit your diagnosis. So I'm going to go ahead and throw in celiac and diabetes. And just as a demonstration, let's say that I did the reasoning a little wrong and decided it was type 2 diabetes. This is what's going to happen. It'll say that the answer was incorrect, and then it'll give a hint. This hint is saying to look more closely at the electrolytes and the liver enzymes. So now I'm going to go ahead and submit the correct diagnosis. And then it says that it's correct. And then finally, it will give some like an example of a model workup for this patient so that I can compare kind of my strategy to like a model example. So in this case, it was recommending starting with the CBC, CMP, A1C, etc. For example, here it mentioned that it would be good to measure the total serum IgA first to rule out IgA deficiency. And so it's useful to see what the model workup would look like. And yeah, that's pretty much it. So that's a demo of ChatDDx, hoping that it can be a useful tool for medical students.